Prazosin Hcl is a medication used to treat high blood pressure. It can be used alone or in combination with other medications. By lowering high blood pressure, Prazosin Hcl helps to prevent strokes, heart attacks, and kidney problems. This medication belongs to a class of medications called alpha blockers. It works by relaxing and widening blood vessels so that blood can flow more easily. It is important to follow the dosage instructions provided by your doctor and take Prazosin Hcl at the same time each day for optimal results. When taking Prazosin Hcl, it's important to follow your doctor's instructions. Usually, you'll take it 2 or 3 times a day, with or without food. If it upsets your stomach, try taking it with food or milk. Your doctor will start you on a small dose to reduce the risk of fainting, and you should take it at bedtime. Your dose may be increased gradually. Take it at the same time each day to get the most benefit from it. Even if you feel well, keep taking it for high blood pressure. It may take several weeks to see the full benefit. Don't stop taking it without consulting your doctor, as stopping suddenly could make your condition worse. Let your doctor know if your condition worsens, such as an increase in your blood pressure readings. As your body gets used to Prazosin Hcl, you may experience headaches, drowsiness, weakness, or blurred vision. These side effects may improve as your body adjusts to the medication. Lightheadedness or dizziness may occur, especially after the first dose or during the first week of treatment. To reduce the risk of dizziness, it's important to get up slowly from a seated or lying position. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks. Most people who use this medication do not experience serious side effects. However, it's essential to contact your doctor if you experience a pounding heartbeat, fainting, frequent urination, changes in mood, or swelling of the feet/ankles. In rare cases, males may experience a painful or prolonged erection lasting 4 or more hours. If this occurs, it's important to seek medical help immediately to prevent permanent problems. A serious allergic reaction to this drug is rare, but if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. It's important to note that this is not a complete list of possible side effects, and if you experience any other effects not listed, it's important to contact your doctor or pharmacist. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088, and if you are in Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Prazosin, it's important to talk to your doctor about any allergies you may have to alpha blockers or other substances. Be sure to discuss your medical history, especially if you have heart problems, kidney disease, narcolepsy, prostate cancer, or certain eye problems. This medication may cause dizziness, drowsiness, or blurred vision. It's important to avoid alcohol or marijuana, as they can increase these effects. Do not drive or operate machinery until you can do so safely. Try to avoid situations where you may be injured if you faint, especially when first starting this medication. If you are planning to have surgery, be sure to inform your doctor or dentist about your medication usage. Older adults may be more sensitive to the side effects of Prazosin, which can increase the risk of falling. For pregnant women, Prazosin should only be used when clearly needed, so discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using this medication. It's important to be aware of potential drug interactions with Prazosin Hcl, as they could affect how the medication works or increase the risk of serious side effects. Remember to keep a list of all the products you use and share it with your doctor and pharmacist. This includes both prescription and non-prescription drugs, as well as herbal products. It's important to not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Prazosin Hcl include other alpha blocker drugs, beta blockers, and drugs used to treat erectile dysfunction or pulmonary hypertension. Additionally, it's important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Be sure to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. It's important to ask your pharmacist about using those products safely. Furthermore, some products may contain ingredients that could raise your heart rate or blood pressure. It's important to inform your pharmacist of all the products you are using and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen/naproxen. Lastly, this medication may interfere with certain lab tests, potentially causing false results. It's important to make sure that lab personnel and all your doctors know that you are using Prazosin Hcl. If someone has taken too much Prazosin Hcl and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe drowsiness and slow reactions. It's important not to share your prescription of Prazosin Hcl with others. In addition to taking this medication, consider making lifestyle changes such as participating in stress reduction programs, incorporating regular exercise into your routine, and making dietary changes. These changes may help increase the effectiveness of the medication. Speak to your doctor or pharmacist to determine what lifestyle changes might benefit you. While taking Prazosin Hcl, it's essential to have your blood pressure and heart rate checked regularly. It's also important to learn how to monitor your own blood pressure at home and share the results with your doctor. This will help ensure that the medication is effectively managing your condition. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. It is important to store Prazosin Hcl at room temperature, away from light and moisture. Do not store it in the bathroom and make sure to keep it out of reach of children and pets. When it is expired or no longer needed, be sure to properly discard the product by consulting your pharmacist or local waste disposal company. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.